not look good.
Dude, that looks like.
Yeah,
you.
it does not look good at all.
It actually does.
Yes.
Is it like bad? Is it bad for people to like squeeze pimples?
Well, I mean, if you do it right, it's not, I mean, you shouldn't do that unless it's really uncomfortable though, because you could get an infection from it.
From popping?
For popping pimples, you could get an infection. Bacteria seeps out of the pimple when you pop it. And so the bacteria could go to other places in your skin and make more acne. So it's not recommended to, it also can cause scarring too. So if you pop pimples, you get more scarring. So generally it's not a good idea to, but if it's really, really uncomfortable, you can, but it's best not to.
It's so annoying.
Yeah.
It's the worst.
I know. Especially with wearing the mask, I get so much acne with the mask. That's why I never wear one because
Guys, I have a solution. Okay, wait. If anyone suffers from acne, has issues with acne.
Every teenager.
Yeah.
pretty much everybody.
Okay, I found like, so you know the Ordinary brand that comes in like the little glass thing? There's this one thing, it's called, it's like zinc 1% something and then like something else. And it's just kind of like this clear, like sticky thing. And what you do is like after you wash your face, you put it on and then you put your moisturizer on and it locks your moisturizer like into your face so it doesn't like come off in your mask or anything. And it has prevented so many breakouts.
Oh,
Giving
that's
me
good to
some
know.
clear skin. So if anyone has issues with masks, try that. I highly recommend.
So do you know what it's called? It's a zinc.
It's like a zinc mixture or something.
You know the brand?
Yeah, it's the Ordinary.
The Ordinary?
Okay.
It's like this, like it's literally like this clear glass.
The brand, the ordinary.
And what
The
is it
brand.
for like you go like this and then you go like this and sucks everything up the tube.
Oh, like a dropper?
Yeah, the top is just a white dropper and it's just like, it says 1% zinc
Huh.
and then another percent nitro something.
Okay.
And it, at first, like when I first tried, I was like, this feels nasty because it's a little sticky. And then when you put your moisturizer on, it doesn't feel sticky anymore. But it just keeps all your moisturizer like on your face. It doesn't come off in your mask. And it doesn't like, you're not like oily and you don't feel weird.
Yeah, right.
So, highly
That's
recommend.
good to know.
It's really helped.
Not heard about
Also, I can talk more about it.
All right, let's get through. So this is about skin disorders. We'll learn about several different disorders of skin. So acne is a very common one. What happens with acne is that sebaceous glands, which secrete oil, get inflamed. So every hair follicle on your skin has an oil gland that keeps the hair from drying out and also your skin from drying out. But there are times when it can get inflamed or closed off and infected, in which case you can get a whitehead or a blackhead. Acne vulgaris is the scientific word for most kinds of acne. It affects the areas of your skin that has the most oil glands. So that'd be your face, chest, and back.
Solid.
Yes.
Are whiteheads, is that like pus and then blackheads is dirt? Or?
It's not exactly, it kind of looks like dirt, and it can be. It's not always though. But yeah, it kind of looks like you have little like black specks. Yeah. So whiteheads would be, the actual, it looks like there's pus in it, is what it looks like.
Yeah.
You can pop those. Blackheads you can't pop. It just looks like it looks like you do have dirt below your skin.
Yeah.
It's not usually though. It's not usually dirt, but it looks like it.
What is it usually?
It's usually dead skin along with some melanin. So melanin gives your skin pigmentation. And so you have some of the dead cells that have given off pigment. And that's what you see as a blackhead. It's the pigment from the cells that have died.
Okay.
And you can see in this picture right here. So this shows you what a whitehead looks like, what a blackhead looks like. So you can see the blackhead is not below the skin, but a whitehead is below the skin. And a blackhead, as you can see, is pointing to melanin, so it has pigmentation. And that's from old cells that have died.
So that's why it's easier to like wash blackheads off, right?
Mhm.
Because they're above. Okay.
Exactly.
Wait, Miss Holly.
Yes.
So when you, I don't know if this is like too personal, but when you were like a teenager, did you have bad acne?
Oh, yeah, really bad acne. Yeah, I did.
So did you ever use Accutane?
No, Accutane, I mean,
Like, what's the deal with that? Because
it's
see
really
videos
dangerous.
Of girls who like get on Accutane and like their face is like bleeding and like,
Yeah.
and it takes 5 months and they have perfect skin, but I'm like,
Yeah.
it looks like literally all the Accutane did was take every single pimple below your skin and push it to the surface. And it's
I
just
know.
bleeding.
Yeah, like Accutane is so scary to me. I never would try that because it just says there's way too many bad side effects to it. Most doctors don't even prescribe anymore. Like most people, you can't even get Accutane anymore because there's just so many bad side effects to it.
What are the side effects?
Well, as you saw, like skin bleeding, like it just takes away your oil. It just removes oil from your skin. And so your skin just dries out so much. And so it's gonna crack and bleed. And it can lead to permanent effects that never go away. So it's really not a safe medicine to take. So no, I never did. Lots of times when I was a teenager, what they would prescribe was birth control to help,
That's,
Which-
I never get.
which is
Birth
really a
control
bad idea.
is-
That's
birth
just,
control makes you gain
oh
so
yeah,
much weight.
it does.
I've seen like videos
I've
of
been
girls
taking it for
before and
years.
after, they gain like 50 pounds.
Yeah.
I'm like,
Yeah, plus it just like alters your hormones.
It
so much
does.
that It like has to be a very serious reason for
Oh,
you to
yeah.
wanna do that.
And acne is not a good reason.
Not a serious-
No, it's
wait,
not.
so obviously like when you were a teenager, you had like a whole skincare routine, right?
Yes,
So do you have that same thing now? or do
I've
you-
changed it over the years. I mean, yeah, back then I didn't, I mean, so
Was it
now,
as intense, I guess, like, cause I know, I feel like when you grow up, like my mom says that like when, as you grow up, you just don't really have acne anymore, like it's just not really. a
yeah,
thing.
I mean, I still do. I mean, lots of adults don't, but I still have acne.
Okay.
But it just depends on the person and how their skin is. But people can have acne well into their, I mean, midlife and onward.
Is your skincare now like less intense, I guess?
I would say it's more involved just because I learned more about it.
Oh, okay.
Yeah, because now I understand like it's important to exfoliate, to use a toner, and to moisturize. I understand that back then.
So does a toner make a
So-
difference? Because I always hear
yeah.
like all these people talk about
I
toner.
exfoliate and use a toner.
It's
Yeah.
the best thing.
Yeah,
I've
no,
ever
toner, like,
found.
I didn't realize that it was a new thing for me. I didn't know until fairly
I
recently.
literally wash my face and then like,
That's what I did as a teenager. I just washed my face.
yeah,
I wouldn't moisturize or anything.
yeah.
But yeah, no, well, nobody taught me. My parents didn't teach me. Anyway, nobody told me.
'Cause I mean, that's what I
And-
did. I know like all these people do like all these complicated things,
Mhm.
but
I mean, for me, what I do is I wash morning and night
yeah.
with a gentle moisturizer, and then I use a scrub every other day to exfoliate the skin. And then a toner every day because that helps close your pores. And so a toner, you can use witch hazel, you can use sea breeze. Those are some of the common toners.
Oh, and
But-
that way stuff can't get in your pores and cause as many
Yeah,
pimples.
and it brightens
Yeah,
up your skin.
exactly.
So, like, it evens it out.
Mhm. No, it really makes a huge difference. Yeah. No, it can make a huge difference. I really recommend it. Yeah. No, I think it can make a big, if you're not using it, I think it'd really help your skin. And then after that,
Which is literally
moisturize.
witch hazel.
Yeah.
Do
Well, like,
genetics,
It closes up the pores. So you like.
do genetics play a big role in like your acne, and could yours be different than like your siblings?
Oh, for sure. I mean, definitely. I mean, genes do play some role in it. But other things too besides your genes. But sure, I mean, you can be more prone to acne based on your genes. But also can be your lifestyle too. How often do you touch your face? You know, are you active throughout the day? Are you sweating a lot? I mean, those are some things also that can cause acne.
If you sweat a
Yes.
lot, would you be more likely to get acne?
Yeah, only because you're rubbing your face a lot. That's usually, I mean, it can also, you can also have clogged up pores from sweating. But the more you touch your face, the more prone you are to acne. And so if you're doing anything that causes you to touch your face, you are going to be more prone to have breakouts. How clean are things like your bed sheets and your clothes? I mean, that can have effect on acne. How clean is your hair? Because your hair can touch your face and cause acne as well. So those are some factors that go into it, but of course genes do have a big role in it as well. And then also allergies can have an effect on, if you have an allergy, that can cause more acne.
Yeah, like if you don't wash your pillowcase enough.
Oh yeah, that's, or even brushing your teeth. I mean, even things like that. I mean, like,
Yeah,
I mean, having
my
the-
dentist is always like, brush your teeth, I'll prevent your acne.
it does,
It's like flossing prevents it too.
it
Yeah,
does.
they say that. That is
Ew, Miss
disgusting.
Holly.
So,
Okay.
yeah, these are gonna be kind of gross, and we're looking at skin disorders, so there's gonna be some gross ones on here. So this usually is more common in babies. You might have seen this in little babies.
Is that dandruff?
Well, it kind of looks like dandruff. It's not exactly. But you ever seen a baby have this?
Yeah.
It's like a bunch of oil building up in their head.
Yeah.
And so this is with overactive oil glands. So seborrhea is an overactivity of sebaceous glands in your scalp.
Different from acne, right?
Yeah, this is all every different. Yeah, these are just different skin disorders that we're looking at. And so this one is just you have overactive oil glands. Generally, it's usually just in babies, and it usually corrects itself very quickly, but it can be in adults too. Adults sometimes can get this. It's just not as common. Is it really that bad?
If you
No.
like,
I
No,
mean,
we're like
if
at
this is
like-
bad, I mean, just wait.
We're gonna be like throwing up for the next.
does it actually help? Like all of my little siblings had that, they're like 5.
Mm.
If you, like, when you like comb their head with like baby oil.
Yeah, yeah, that definitely helps.
But does
Yeah.
that make it worse? Because you're putting oil on.
No, moisturizing, if you have a lot of oil secreted, moisturizing it makes it better because you're going to have the oil glands work less. So if you keep it moisturized, that's going to help you reduce oil buildup.
Oh, yeah, it's like, doesn't it kind of with your face, like,
Exactly.
your face, like, if you don't have oil or like enough moisturizer on your face produces its own oil, but the oil is dirty, so that's how like, you can also break out.
Exactly. Yeah.
My skin is just weird, so like before, like at night, like straight oil like goes on my face.
Mm.
Like, I don't know why I need that, but I do. Like that's just how it is.
Yeah, no,
I
yeah.
like wash my face and then put coconut oil on.
Yeah.
Yeah,
like,
I mean,
something-
that really helps.
I know, my mom just says that, I guess, when your face first, like hair produces bad oils, it's like, gross, it's bad for you.
Because, like,
Exactly.
some people, when they're trying to get rid of acne, they'll like rub alcohol all over their.
Yeah, and that's so bad.
Then your skin
That
overflows
just
with
makes it
oil.
worse.
Yeah.
That you do not want to dry out your skin.
Yeah.
Yeah, that just is, that's the worst thing you could do for your skin. You want to keep it moisturized. Yeah, don't, yeah, using harsh things is not going to help acne. Another one is alopecia. It's sudden hair loss, and it can be in patches. This is very rare.
So this is a skin disorder.
Yeah, that's right. And so hair is part of your skin, which we don't always think of it that way, but we consider hair part of the skin. And so anything that affects the hair is due to the skin having something happen to it. So it could be autoimmune. Nobody really knows exactly why this happens to people, but it's possible the body attacks the hair follicles and they just fall out because of that. But even if this does happen, usually it's temporary and the hair does grow back in a few months. Your hair does go in cycles where you lose hair follicles naturally over time, but generally if the cycles are aligned, you're going to replace the hair follicles too as you lose them. But there are times when the cycles don't line up and you lose a lot all at once and don't replace them, in which case you can lose a clump of hair and not have it replaced for some time. But usually it's not something that's going to keep, it won't stay that way usually. Usually it grows back.
Can it be caused by stress?
Oh, it definitely can be caused by stress. Yeah,
That just makes me
yeah,
worse.
it can
I
be,
feel like
yeah.
I've seen in movies, people who are stressed in their hair.
Yeah, no, it definitely can happen through stress, thyroid problems too. If you lose a lot of hair all at once, it is a sign you could have a thyroid issue as well. So you definitely want to go to the doctor if you lose a lot of hair, like more than you're used to losing. So it's not balding because balding is permanent hair loss, and this is something that is not permanent.
What happens with balding?
Balding, the genes turn off the hair follicles. So it's genetic where the genes just stop producing hair.
Is it like a way to save energy for the rest of the body to like?
I mean, I suppose, I never thought of it that way. But I don't know what the purpose of balding would be. I suppose
Yeah.
it could be. I mean, that would make sense. I never really thought about why we bald.
Yeah.
But I mean, basically, as you age, to define aging biologically would be you lose more cells than you make. And that's what aging means.
Yeah,
And so as you get older, you just stop making the cells that you need.
yeah.
And so that would also include balding. No, so Madeline tested negative for COVID. For Madeline Mahaffey, sorry. Yeah, we had more than one Madeline. But now the boys are sick.
Boys.
Her boys, yeah.
Oh, no.
So she's still home and everything?
She might be here.
Well, she came in earlier to drop off some papers.
Yeah. Missing my half of it.
Yeah, and then when I was coming in from voting, she wasn't here anymore.
She voted it?
All right. Okay, athlete's foot, a fungal infection of the foot.
This is, I'm gonna throw up.
Really? This is that bad?
It's-
That means there's worse.
Oh, there's a lot worse.
There's worse coming.
Oh, yeah, this is, there's worse. It's just,
Okay, maybe none of us can go in the medical field.
maybe not, I don't know. Wow, I didn't think it was that bad.
It's just like, if you think about it too much, like, I feel like I let myself get grossed out about the first one.
Oh,
You
yeah.
actually have to like touch this with gloves and everything.
Or even without gloves,
Yeah, no.
Okay, sometimes I like weirdly get grossed out by like anything, and then other times I won't be grossed out by anything, and I like do all this stuff because I'm like, I can just wash my hands.
right,
I don't know.
exactly.
It's like
Yeah,
really
that's
weird.
how I think of it.
Never be grossed out by the things I'm grossed out. There's no way I actually.
So athlete's foot is when a fungus is growing on your feet. And it's usually because the feet just have too much moisture on them. So that could be, like its name implies, athletes get this a lot because they're sweating. So if you have prolonged wetness on your feet, generally through sweating, but also if you're out in the rain and your feet are soaked and you don't get them dry for a while, that could also cause athlete's foot. You could also have it from sharing showers, especially in dorms or gyms. That can also be.
If
Watch one of
anyone
us
in here
get
goes to like a community bathroom college place, bring shoes.
Oh, yeah,
or,
yeah,
like,
always use
sandals or
shoes.
Crocs,
Yeah.
please,
Yeah,
and
don't go
run
barefoot in there.
showers.
You can get warts in there. You can get athlete's foot. Yeah, it's really nasty. So it can cause itching.
It's so gross because you're supposed to get clean when you take a shower.
I know.
And then you have,
Yeah, it's just not that clean in there. The feet itch, they can burn, the skin flakes off, toenails can turn yellow. So as I mentioned, when the feet stay moist for prolonged periods of time, it's generally just because you're wearing sneakers with socks and you're sweating, or if you're just out in the rain. So the fungus can live for a long time in bathrooms. It can be on the floors of showers, it can be in the towels, it can be in your shoes. So it's important to, especially if you have athlete's foot, to wash your towels every time you take a shower and to make sure your shoes and socks are cleaned. Because it's good to sanitize your, football equipment if you're in sports like that, or if your shoes, but putting them out in the sunlight because sun kills germs. UV radiation kills fungus,
Is that why we
bacteria.
don't really get sick as much in the summer?
Exactly. Yeah, because the UV radiation is just so intense.
And we're like outside more instead of inside with the
Mhm.
same air. Okay.
Exactly. And also viruses don't live as long in humid environments. They live better in dry, colder environments.
Wait, then why is it that like the flu or colds come around in like October, November when like the weather is usually supposed to be nice outside and like you can have like your door open or like your window open like in your house so that the air circulate like. we're
The
in
sun's not
summer,
as
like,
intense.
sweating all the time.
Right. Well, the sun's not as intense in October. It's a lot less intense. That's one reason why. Another reason why is up north, it is very cold. And so the virus can circulate up north and come down here, even though we're not that cold yet. They are cold up north, and that can move the virus downward to us. But the biggest reason really is the sunlight becomes less intense in the fall time. Somebody have these down?
Yeah.
Sometimes a bleach bath can help with athlete's foot, but you just don't, you don't want to put a lot, you have to make sure you put the right amount of bleach in, because too much bleach can really affect your skin.
Yeah, I thought you
But-
were like put your foot just in a whole.
Yeah,
bead.
no,
I was like,
definitely don't do that, no, that would really be bad. But you look online for the right amount of bleach, but that can help with athlete's foot too. It can help kill the fungus.
I could never be like working my nails on
Yeah, no,
Oh,
mm-mm,
because they have to like scrub the foot.
exactly, yeah, no.
and they don't wear gloves.
Mm-mm.
They don't wear gloves and like I've seen
What's
some
the matter with
people
you?
in
I
there.
felt like I was bleeding.
Kind of looks that way, but no, it's just a birthmark. So some birthmarks can be red or purple, yeah. So birthmarks, like the name implies, they're visible after you're born, right when you're born or soon after, and they stay for life generally. So it can be blood vessels that are overgrown because, as we learned before, there aren't many blood vessels on your skin surface. They're usually below the skin surface. But for this person, you can see that it's red. And so blood has come to the surface. That's why it appears red. It could be other things like melanin, smooth muscle fat, fibroblast, or keratinocytes. Those all can move up to the skin surface and cause different colors. Does anybody know who that man is?
Wait.
He was a leader of Russia. No, not Putin. After Stalin.
Okay, I'm so.
No, it's good to,
Lenin.
Gorbachev? Yeah,
What the heck?
Mikhail,
Wait,
yeah,
Donald's so
yeah,
sorry.
Mikhail Gorbachev. He,
Okay, who are the leaders of Russia?
right now,
Yeah,
Putin.
it is.
Yeah, he's
And
president.
who was before him?
Before Putin, I think it was Gorbachev before Putin, if I remember.
And then
And-
Stalin.
No, Khrushchev was after, before that.
When was Lenin?
Lenin and Stalin were like early 1900s, like 1917,
Lenin was in the
1910.
First World War.
Like they were in the very early,
Because he got
like
kicked out.
through 1940s. Like
Right,
that was
yeah, yeah.
Stalin. Stalin was like around Hitler's time.
Because he was like Hitler's time and FDR's
Mhm.
time. Okay.
Miss Molly?
Yes.
What category do freckles fall
Oh, freckles, their own category. So I mean, they're kind of like, they can be like birthmarks or like moles. I mean, they kind of look like birthmarks and like moles.
Wait, Miss Holly, you said that Maryland tested negative and now for boys are sick?
Yeah,
Are they gonna get tested?
I would. Yes, they are. Yeah,
So are they still gonna have quarantine then?
I guess. Yeah, I don't know.
I don't know why we're still here.
Well, I think as long as you're healthy, I don't really see a reason to go home.
I feel like she's just waiting.
Wait, can you go back for a sec?
Like, is she waiting for more people to get it?
Well, I mean, the thing is, that COVID is going to be, I think, a fact of life for a while. And I don't think we can just shut down for every single
Because
case,
also people really, you don't die. You are
No.
not likely to die.
especially
Like,
people
not
your
our
age.
Exactly.
I mean, no,
And so like, do we
That's-
really want to shut down
no.
life just to avoid getting sick? We get sick anyways. Like, I feel
exactly,
like we have to reassess our priorities.
exactly. No, I agree, the same thing. I mean, we're going to have to get used to this we're going to have COVID for a while, I think.
I know a lot of
And so we just
doctors-
can't shut down every time we get a case or two.
I know a lot of doctors, my dad works with, I think they came up with a draft, like, trying to like address like the government that says like to let the people who aren't in the age of like risk just live their life. So
Yeah.
that they all get it,
Mhm.
and then once everyone's gotten it, then it'll be fine.
Yeah, I agree with that. I think that's the best way to go about it.
The main thing at this point is just trying to not get enough cases so that the government gets leverage over.
Exactly. Yeah. And just recently, El Paso has a curfew, I think just last night, where it's a 10 p.m. to 5 a.m. curfew. And they have stay-at-home orders now. So,
Wait, how's?
so are you in Texas? They're going back to shut down.
In El Paso.
Oh, gosh.
It really is too bad that they're like using it as a political tool because our politicians, they should care about us and care
Sure.
for the people, but they're like using the people just for their own gain. It's just so stupid.
I think a part of it is that they're just so afraid. They're terrified they're going to be blamed for the coronavirus and that they have to have the appearance of doing everything they can do. And so it's easy for politicians to say, okay, let's lock down. Because if they lock down, they can't be blamed for what happened.
Yeah.
And so I think it's more of just because they're just so afraid of being blamed for deaths.
Yeah.
Like you look at Andrew Cuomo, he lost so many people in his state, like 30,000 people. But nobody blames him. Well, a lot of people don't blame him for what happened because he had the appearance to do everything he could do. He locked down his state. And so they say, oh, he did a great
So
job.
it's all about like appearances and keeping up your status.
Exactly.
Because he like sent people, didn't he send people
To
God?
nursing
To
homes.
nursing
And that's why people died.
Everybody died.
That's why it got so bad in the
And
state.
New York is the worst it has ever
Oh,
been.
yeah. Yeah, not even
Like
close.
New York is horrible right
Yeah.
now.
Exactly. And so he really has a lot to blame for it, but nobody blames him for it because they say, well, he tried his best.
He
And
made everyone wear masks. He was in luck. Yeah.
exactly. I think that's really what it comes down to is like some people I think do want the power, but I think more it's just that they're so terrified of being blamed and responsible for the deaths of people.
Yeah. Like they're
So-
scared and everybody else is scared. Like everybody's just terrified.
Exactly. And when people are terrified, they don't really think clearly. They don't really make good decisions when they're afraid. That's what.
Well, what are we gonna do like when, like, we go home for Thanksgiving from being like here?
Mhm.
Like, we don't want, like, I have family members around, like grandparents.
Just get tested. You can get a rapid test in 15 minutes. I mean, that's what I would do if I were you.
Yeah. I would-
Like that's what I do every week. Like because I see my dad and my mom, and they're old, and so on Friday I get a rapid test, and so I know my results in 20 minutes, 15 minutes.
Is it up
And-
to
We should
and then-
do that because
yeah.
my grandparents
Yeah, it
are
was like, it
very
feels really weird,
cautious
but
and
it's
we
really
might be
fast and
cautious
you're
too.
done.
But so then we just get that and we know if we're contagious
Yeah,
or not.
exactly.
So then there's nothing to worry about.
Yeah. And so you can go like if you have an insurance plan, it's free anywhere you go.
Even if
Uh,
you're a minor, under 18.
I don't know about, I guess I don't know about the minor. I never looked into that. So I don't know about if they're different for minors or not. I'm not
Or
sure.
they're just trying to make it
But
as accessible as possible.
I would assume it's, I don't know. I don't really know the rules for people under 18. I just know for adults, it's free, no matter where you go to get tested.
That's good. I'm
And-
really glad that they're trying to make it super accessible.
And it's so easy. I mean, there's so many places that have rapid testing.
Yeah.
I know like 3 or 4 around this area. And you can go in there, it's really fast, and then you know right away. And so that's what I do. If I'm gonna see somebody that I haven't seen for a while, like I get tested before I go and see them. And I know for sure. And that's really the way to move forward, I think, is just rapid testing. Because I think we're getting really close to this, where at schools, we will test everybody when they come into school. Like using a saliva test.
Yeah.
And we'll just know right away who has and who doesn't, and then we'll be safe.
Yeah.
Like no mask wearing even, because we know who has and who doesn't.
Yeah, I think it's
Yes.
interesting because everybody really wants to bring up all these problems and everything, because obviously there's tons of problems with our society, there's problems with the way COVID's being handled. But I feel like so many people are able to point out all the problems, but they don't care about solutions. They don't even want to like talk about solutions.
Exactly.
And I feel like once you try to talk about solutions, they'll just like shut down or like, you know what I'm
Yep.
saying? And
Mhm.
like, obviously we need to talk about the problems, but then like, what's the point of that if you don't take a step further? And it's also the same thing, yeah.
Yeah, I agree with that. People just want to tear down, just criticize and just tear people down, but not look for a solution to make things better.
Yeah.
It's so easy to do that. It's a lot easier to just
I mean, I do that
criticize.
all the time, exactly, yeah.
I mean, I don't see you doing that, but I mean, it's just very easy to do that though.
Yeah.
It's hard to offer a solution and think of a way to make things better than to just say, "Oh, that's awful."
Yeah.
But I think we are very, very close to having tests available where we can test everybody in schools. And
Just,
probably,
like, instead of taking temperatures in the morning. you just-
we actually would know for sure. We would,
Of course, there's
So-
always still a chance it could be false.
but then you
positive.
test it again. Like you can, like if it's positive, you can test it again just to confirm it. And then, but yeah, I mean, definitely you could have a negative when they actually have it, but that would just tell you that they have it, but they're not contagious. And so you can test the next day, they would become positive when they're contagious. So that can happen, but I would think by December we'd have that. We'll see, but it sounds like we're very close to having that available. Which I think is the best way to, I mean, we just have to assume it's gonna be with us for a while. We can't lock down forever. We just need to find a way to test people and quarantine those who are sick. And those who are not, just keep on going out and doing what they're doing. Okay, so really fast before class ends, a boil, which is probably one of the grosser ones on here, it's caused by a staph infection, which you might have heard about before. Staph is a bacteria that's very hard to kill. Staph, about 20% of people have staph in their nose.
In their notes.
That's right. And so that's why it's so important when you blow your nose to just throw away the tissue, because you can have staph in your nose without even knowing it. It's naturally in there without usually causing problems. But if it goes from your nose to your food, it can make you very sick. Yeah.
Yeah.
It is nasty.
People smell the inside of their nose.
Smell inside your nose? I mean, not you know, only